Hello, everybody. Welcome to Doc Dynasty. I am Dr. Poe Raval, 36 years as a private practitioner and growing. And today we are going to talk about the most important paradigm shift that's going on today, and that is called partnering with your patient. So why is this paradigm an important one? In the past, it's always been about doctors seeing as many patients as they could. The more patients you see, the more money you make, the more you can expand, you can take on partners, you can do more. Happy to let that paradigm go, because now the focus is on being very efficient with your time and having your patient become your partner. So how has this changed? There are three things that are game changers in today's paradigm partnership. Number one, patients have access to care. They can come to your office directly. They can come to the hospital. They can go to an urgent care center, and all their files are digital. So they can share files, have access to their files, and also see what's been happening over time so that they can figure out what they may need. They are now partners in trying to figure out where their symptoms are coming from. Number two, information is portable. So this portable information, very important as patients sign into their platforms and their portals, is that you can now collaborate and send other doctors that a patient picks information from a hospital, an urgent care center, an emergency situation outside of the country, or between specialists. They are as much in charge of their care as the doctor. And number three, the ability for a doctor to participate actively with their patient. So it is not just about Dr. Google, who is sometimes wrong, but it's also about collaboration through a history of files that the patient shares with you and can collaborate with you. I, as a podiatrist, have been doing this for years because I deal with a very active population by and large. And oftentimes they have goals where I do this now, I want to do this. How do I get from here to there? Very important and very positive. Not about how many patients you see, but treating your patient efficiently and as a collaborator. What has changed this? So obviously, the access to digital information has changed this, and we're going to find that this is happening more and more as AI sets in. Already residents are using AI for the classroom to differentially diagnose with just their phones or their iPads. So instead of having to research, basically you're putting in symptoms, and you can actually even download what a patient has said to you, and it'll spit out a fairly accurate differential diagnosis. That will only evolve to get stronger. And also I find, as we've talked about in these, in Archmaker, which is my site for patients, blood tests are being used now and for genetic testing. So they're going to become very accessible to see what your family history is and coordinate that with your symptoms. So it's not just about research anymore. We're able to collaborate all this using AI technology and blood tests that will become very accessible for patients. So welcome to the age of partnership. I welcome it. I hope many of you do too. And you medical students that may be in various phases of your training, I think you need to be prepared for that. You are no longer that godlike figure. You still have your degree and your expertise, but it's about collaborating with your patients. I think it's a change for the better.